Hi, my name is Dr. Natasha, and welcome to Pregnancy Health with Dr. Natasha. So, just a little bit about myself. My background is I am an OBGYN physician. I am also a National Academy of Sports Medicine Certified Personal Trainer, and I am a pre and postnatal performance training specialist. And I am the owner of Bump Fitness Club. So, Bump Fitness Club is a boutique fitness studio that I started here in Chandler, Arizona, where we have created a safe, supervised, and supportive environment to encourage physical activity and exercise during pregnancy. I started this YouTube channel to provide a way to educate women and dispel myths associated with exercise and pregnancy. So if you're interested in this topic, you want to learn more, hit the subscribe button. As we go through the presentation, if you like what you see, also hit the like button and then leave me a comment and let me know what you thought about the presentation. Or if you have any additional topics that you would like for me to address in the future, also drop a comment and let me know that as well. So we'll go ahead and get started. One of the first things that I want to kind of take the time to do is define what is physical activity and what is exercise. We kind of use these terms a lot in our day-to-day life, but they are actually two very different things. And I thought it was important to kind of define that before we get too deep into the presentation. So physical activity is defined as any movement of the body that requires energy. It helps to maintain and improve the functioning of the heart and lungs. It decreases the risk of medical problems, such as high blood pressure and diabetes, and it can result in a longer life. So common physical activities that we do include household chores, walking a dog, playing with the kids, taking a leisurely bike ride, hiking, and playing sports. Ironically, according to the World Health Organization, 1 in 4 adults are not active enough. So let's contrast that with the definition of exercise. So exercise is the planned, structured, repetitive movement of the body, also with the goal of improving fitness. And so when we talk about planned, structured, repetitive movement, that would be taking a group fitness class. It would be, if you're a marathon runner, planning how many miles you're going to run, planning your pace, planning or structuring your program so you gradually increase your distance or you gradually increase your pace. If you're like me and you're really into weight training, I do a 3-day split. So I do leg and abs, back and thighs, and chest, shoulder, traps, and triceps. So that's how I arrange and structure and plan my workout. So the recommendation is for 150 minutes of moderate intensity exercise per week. So how do we define moderate intensity exercise? So basically, it should be enough movement where your heart rate increases and you start to sweat. It can be taking a brisk walk. It can be going for a swim. Contrasting that with vigorous intensity exercises. So the recommendation for that is 75 minutes per week. And vigorous intensity, that would mean like going for a run at a high pace, or sprinting, or doing a HIIT or high intensity interval class. Those would be considered vigorous intensity exercises. You can pick either category, or you can do a combination of both. So how does this translate into what we recommend for pregnant women? Well, first of all, pregnancy is the ideal time to maintain or adopt a healthy lifestyle, including exercise. So pregnancy is a very motivating point in a woman's life where we want to do what's best for ourselves and what's best for our baby. So take, for example, if you have someone who smokes cigarettes and then they get pregnant and they quit the cigarettes cold turkey and like their mind is just blown. But that is that motivation to do what's best. And so as physicians and as trainers, we have to capitalize on that motivation and use it as encouragement to our clients and our women to get them up and moving. And so women with uncomplicated low-risk pregnancy should be encouraged to participate in aerobic or cardio and strength training exercises or strength conditioning exercises both during and after pregnancy. The Department of Health and Human Services, in addition to the American College of Obstetricians and Gynecologists, recommends that pregnant women focus in or make a goal of that 150 minutes of moderate intensity exercise each week, both during pregnancy and after delivery. And of course, before you start any exercise program, and this is, before pregnancy, during pregnancy, and after pregnancy, you must talk to your healthcare provider, whether it's your doctor or midwife, to make sure that exercise will be safe for both you and your baby. Women with complications should definitely be evaluated and talk to their provider before participating or starting a program. So one of the reasons why I started this channel was to help dispel myths associated with exercising and pregnancy. And I also have a goal of educating my audience about exercise and how to properly do it so it benefits both mom and baby. So some of the myths, and these myths have stood the test of time. Even though scientifically they have been debunked, I hear it a lot that pregnant women, oh, you should just take it easy. You should eat for two. No. Enjoy your pregnancy, but also be motivated to just keep moving in some way, shape, or form. So a couple of those myths. So the first myth is exercising may cause miscarriage. Exercise may cause poor growth of your baby. Exercise may put you into preterm labor and then you end up having a preterm delivery. And then finally, pregnant women are more prone to injury, so they should not exercise. So like I said, all of these have been debunked. Studies have shown that exercising does not increase the risk of miscarriage. Exercise does not cause your baby to have issues with growth. In fact, studies have shown that if you start exercising in the first trimester, you get more blood vessel formation in your placenta. And so as your pregnancy progresses, your baby gets even more blood, more oxygen, more nutrients because you were active in the early stages of pregnancy. Exercise does not cause preterm delivery or increase your risk for preterm delivery. In fact, a lot of situations with preterm delivery are due to the development of complications. So if exercise decreases your risk for complications, and then you get to progress in your pregnancy and let your body determine when it is the appropriate time for you to deliver your baby. And pregnant women being more prone to injury, that is where modifications in the type of routine and exercises that you do come into play. If everything is appropriately modified, you actually shouldn't have a higher risk of injury exercising during pregnancy compared to exercising before or after pregnancy. So what are some of the benefits of exercising while pregnant? It promotes a healthy weight gain. It may decrease your need for a cesarean section, and it may result in a faster labor. So in terms of promoting a healthy weight gain, based on your BMI or body mass index, there is a range that you should gain in terms of weight throughout the course of the pregnancy. So a combination of good nutrition and exercise will help you stay within or as close to that range as possible. And in terms of decreasing the need for a cesarean section. And so remember how we talked about if you start exercising early in the pregnancy, you get more blood vessel formation in the placenta, more blood, more oxygen, more nutrients flowing to baby. Well, that benefits baby when it comes time for pushing and delivery, because think about all that extra blood flow that is going to the baby at this very critical moment of labor. And so it helps the baby to withstand the stress of contractions and labor and pushing. So you're less likely to need a C-section for issues such as your baby's heart rate dropping. And then it may result in a faster labor and delivery. Other benefits of exercising during pregnancy is it decreases the risk of complications such as gestational diabetes or gestational hypertension, that's high blood pressure, preeclampsia. It can reduce back pain. It can improve constipation. It can help you manage those hormonal mood changes that are associated with the fluctuating hormone levels throughout your pregnancy. And it helps you to get a jump start and promote postpartum weight loss. So key points about exercise. So you've made the decision that you want to try and be more active and exercise. And so a couple of things that you should remember. If you were participating in an exercise program before pregnancy, you may be able to continue with that program during pregnancy, but only with the appropriate modifications. I would recommend that you discuss what type of program you were participating in with your healthcare provider and just get the okay from them that you can continue. And then again, make sure if it's a group setting or you work with a personal trainer that you let them know that you are pregnant. And that way they can modify things appropriately. And then if you're looking for a trainer or an instructor that is certified in prenatal and postpartum women, you can certainly seek those out as well. The other thing about exercising during pregnancy is we really want to focus in on those moderate intensity exercises. Unless you are a very well-trained athlete, we really want you not to do vigorous intensity exercises. And so how is it that we can gauge what is considered moderate intensity? So there's a couple of things that we can use. There's the rating of perceived exertion. There is heart rate monitors and things like that. But honestly, the easiest way to gauge intensity is the talk test. And so when you are exercising, you should be able to have a full conversation with the person that is standing next to you. If you are unable to use complete sentences, if you are gasping for air every other word, then you need to tone down your intensity. Other key points to remember. Now, all of this advice is very general. Again, I understand that everybody's situation is different. And so again, make sure you talk to your healthcare provider about the specifics for you. But generally speaking, after about 16 to 20 weeks, you should avoid lying flat on your back for long periods of time. This can decrease the amount of blood flow returning to your heart from your legs, and it can cause like issues with feeling faint, dizziness. Sometimes you can feel like nauseous because of it. And so again, we want to make sure when you get to that stage of pregnancy, if you are doing exercises that require you to lie on your back, maybe you can prop yourself up on a pillow, give yourself a little bit of an incline as a modification. The other thing to remember is relaxin is a pregnancy hormone that can easily cause you to lose your balance. Relaxin affects women very differently. Some have just like no effect at all. And some people, they feel very unsteady even with walking. And so the purpose of the relaxin is to kind of mobilize your joints, your ligaments, in preparation for preparing the body for the labor and delivery process. And because you have that laxity in your joints and your ligaments, it is it can increase the fall risk for you. And so how do we modify that or account for that with exercising in pregnancy is we want to make sure we avoid unstable surfaces. Another thing you have to be very careful, if you're feeling unsteady, definitely you want to reconsider doing single leg exercises. Again, relaxin affects everyone differently. So if you have no effect from it and you're used to doing things like single leg deadlifts and you want to continue that, just listen to your body. If you are on the opposite end of the spectrum and like I said, you feel very unsteady, even with things such as walking, and then you have to account for that and make sure that everything you do is on a stable surface or you have your two legs as a base of movement. And then the other thing to remember is it's very important to utilize proper breathing technique. So we want to make sure we minimize the stress that is placed on our abdominal muscles and our pelvic floor. So this is mostly exercise and body awareness. So we want to make sure we coordinate our breath with our movement. And so typically the recommendation is you exhale on the effort, and that is going to help minimize the stress of those very important core muscles. So another key point is during pregnancy, your metabolism increases to support both you and baby. So it's going to be very important that you eat a snack about 30 to 60 minutes before your workout session. So that way you have enough energy to fuel your body during your workout. And so we recommend, or I recommend, eating a snack, a small snack that's complex carbohydrates, proteins, and some fat. So let's think about it for a second. So if you grab a bag of potato chips before you head to the gym, those potato chips are going to be very easily digested by your body. So you're going to get a huge kind of immediate rise in your glucose or blood sugar levels. And then when you start your workout, your levels are actually already used up towards the front end of your workout. And so if you eat a snack of complex carbs, proteins, and fats, you get a smaller increase in your blood glucose or sugar levels, and you get a gradual tapering off of that. So your body is better able to evenly distribute the sugar so you can use it throughout your workout. So an example would be, sometimes if I need something really, really quick to eat on my way out to the gym, I'll make myself a peanut butter sandwich. I'll use whole grain bread. I'll use like the appropriate serving of peanut butter, usually like 2 tablespoons. And then I'll eat that about 30 to 60 minutes before my workout. And I have enough energy to fuel my workout. The other thing you want to remember is to limit your exercise sessions to 60 minutes. The longer you exercise past an hour, the higher your chances are of dropping your blood sugar levels too low, resulting in a condition called hypoglycemia. And usually we can tell when we're to the point where we need to eat because we feel nauseous, jittery, kind of faint. Some people can get sweaty. So definitely want to make sure that we are taking those precautions and making sure that we're not exercising for very, very long periods of time. And lastly, hydration is key. So you should be drinking half of your body weight in water every day. And I know that that's like super, super hard. And I know like with being pregnant and always having to pee, a good way to kind of determine if you're adequately hydrated is looking at your urine. So if your urine is running clear like water, and then you can actually decrease your water intake because you're very well hydrated. If your urine is dark like tea or Coca-Cola, and then you need to increase your water intake because you're dehydrated. So the key is to find the kind of happy balance in the middle. You want your urine to be a clear yellow color, and that's how we know that we are well hydrated. So now that we've kind of given a little bit of background in terms of, what myths are associated with exercise, why we should exercise, what are some of the modifications we should make, and just defining what's physical activity and what's exercise, let's talk about what exercises are actually safe for pregnant women. So walking is so important. Even if you can't do anything else, going on a 10, 15, 30-minute walk after a meal goes a long way to helping to prevent and decrease risk of pregnancy complications. Other alternatives would be stationary cycling. And we say stationary cycling because remember that it is very the effect of relaxant. And so if you get on an actual bicycle, it could be harder for you to balance yourself on a bike. Also, as the pregnancy progresses and your belly is getting bigger and baby's getting bigger, it can also be very difficult to balance on a bike. So if you use a stationary bike, you take that balance factor out of the equation. The other safe exercise would be aerobic exercises or cardio. Again, the key with the cardio is to make sure you're not overexerting yourself, to make sure that the session isn't too intense. So again, the talk test is going to enable you to determine that, or determine that intensity. So make sure that you can speak in full sentences throughout the entire course of your session. Dancing is another great way to get moving. Resistance exercises, so those are strength training exercises, stretching, and water aerobics. And I will say water aerobics is good for ladies with a lot of joint pain because the water makes the body weightless. And so it's very, very, very easy on the joints and it feels great. Okay, so now that we know what is safe, what should we avoid? So contact sports. Basically, don't do anything that has the risk of you getting hit in your stomach. All right, skydiving. If you do an activity with a high fall risk, so an example of that would be horseback riding. You want to avoid extreme heat. So your hot yoga, hot Pilates, scuba diving, you want to avoid, and then exercising at a high elevation. So typically it's recommended that you stay below 6,000 feet above sea level. All right, so you've decided that you're gonna start your program and you're super, super excited for your first class, and you just want to know what are some of the things that you should look out for that would be your cue to maybe stop your session. And so one, I always say, listen to your body. And we hear that phrase so much, but there are also some pretty standard things that we should be looking out for that if they occur, we should be either cutting back on our session or ending that session and maybe trying again another day. So vaginal bleeding, you definitely want to kind of, reassess that and then reach out to your healthcare provider. Dizziness. So the biggest thing with dizziness is that's why we recommend making sure that you're adequately hydrated leading into your session and that you have that snack 30 to 60 minutes before you begin your session. And that will help to decrease the risk of dizziness. The other thing is be mindful of position changes. So if you're going from the floor to standing, make sure you do that slowly. Don't just jump up and change positions suddenly. You'll usually, you can feel dizziness with that as well. Shortness of breath before exercising. So if you're already short of breath, and then you definitely want to skip the workout for today. Chest pain, headache, muscle weakness, calf pain or swelling, particularly if it's one-sided. If you're having regular painful contractions, you're probably not going to feel like exercising anyway. And then, of course, if you're leaking amniotic fluid, again, do not exercise. Reach out to your healthcare provider and let them know what is going on. All right, so for the most part, exercise is safe and recommended for low risk and uncomplicated pregnancies. If you are considered higher risk, let's say you have diabetes or you have hypertension or high blood pressure, you have a thyroid disorder, et cetera, just make sure you talk to your doctor. Even in those situations, exercise can still be done and still recommended and still appropriate and be beneficial for you and baby. But there are some conditions where we absolutely want you to avoid exercise. And remember, exercise is the planned and structured repetitive movement of the body. And so even though we're saying no to exercise, walking is always something that we can do. And like I say, even if you go for a 10 to 15-minute walk after a meal, that has benefits for both mom and baby. So avoid exercise if you have any of the following. So severe heart or lung disease. So let's say you were born with a cardiac abnormality or a heart abnormality, or you have severe lung disease. So you have like poorly controlled asthma, and then you might fall into the category of being unable to exercise. If you have a cerclage in place, so that's the stitch that we use for treatment or management of cervical insufficiency. That's also known as an incompetent cervix. So we certainly don't want you exercising in that scenario. If you're pregnant with multiple, so let's say you have twins or triplets or, quadruplets, and you're at high risk for preterm delivery, and again, we don't want you participating in a moderate intensity exercise. If you have a placenta previa, so that's a condition where the placenta covers the cervix, that condition puts you at high risk of vaginal bleeding. So again, we don't want you exercising in that scenario. If your water bag has broken, if you have gestational hypertension or preeclampsia, or severe anemia, those are other conditions where we recommend avoiding a structured exercise program. And when I say severe anemia, we're talking to the point where your doctor is recommending blood transfusions or iron injections or iron infusions as part of your treatment plan for your anemia. And the other thing to consider as well, if you are severely anemic, your body is going to let you know during your session. You're going to have more dizziness, more shortness of breath. You're not going to be energized to complete a full workout session. And so that's where we want to encourage you to listen to your body. But it doesn't mean that you can't go walking for 10 to 15 minutes. All right, so we're going to wrap this up. Just to kind of summarize a couple of key points. Exercise is safe and recommended for low-risk, uncomplicated pregnancies. If you have a complication or you are considered higher risk, make sure you talk to your healthcare provider, your doctor or your midwife, to make sure that exercise will be safe for both you and baby. All right, exercise has many benefits, including decreasing the risk for pregnancy-related complications like gestational diabetes, gestational hypertension, preeclampsia. It also can decrease the need for cesarean section and potentially result in a faster labor and delivery. So the goal is 150 minutes of moderate intensity exercise each week. Make sure you can pass the talk test. Remember, you should be able to talk in full, complete sentences with the person standing next to you throughout your entire session. If you can only speak a couple of words before you're kind of taking a breath, then you need to lower the intensity. And then finally, any movement is better than no movement. So even if you're not participating in a structured exercise program or a class, going for a walk, like I say, 10, 15 minutes after a meal can work wonders for keeping you conditioned and keeping your body better able to take care of both you and baby. So I hope that you enjoy this session today. If you want to reach out to me, there's a couple of ways that you can do it. You can call or text me at 480-242-6856. You can send me an email to natasha@bumpfitnessclub.com. If you are local to the Chandler, Arizona area, just shoot me an email, give me a call if you want to come and check out my studio here. You can also follow Bump Fitness Club on social media. We are on Facebook and Instagram, and then also you can visit our website. So don't forget, if you want to hear future content about exercising, pregnancy, healthy tips for a great pregnancy, subscribe to this channel. Hit the like button if you enjoyed this presentation, and then also leave me a comment for any feedback. So thanks for hanging out with me today, and I will see you guys soon.